Okay, so let's try to talk about acetabular fractures. So, in order to talk about acetabular fractures, let's start with a little bit of very important anatomy of the acetabulum in order to understand the classification and the types and to identify acetabular fracture. And I'm not going to get into every type of fracture. There is a classification system which is called Janet and Letourneau system, which classified the fractures of the acetabulum into, let's call it 10 types, 5 elementary types, and 5, let's call it combined types or associated types. So this is the classification, and we will look into it, but not deep inside it. I'll just present it. But let's talk about very important landmarks in the acetabulum and to identify fractures. Now, remember, just to start, the acetabulum is an area which is built from 3 bones that ossify together as adults, as an adult. So iliac bone, pubic bone, and ischium. Those 3 bones come together and creates the acetabulum, which the femoral head sits inside it. Don't forget that this area is not a fracture, it's not a subchondral damage, subchondral injury. This is just the area from which the transverse ligament sends its ligamentum teres to the femoral head, to the pulvinar of the femoral head. So there is no fracture right over here. And we will talk about that W. You see here the lines, and I have a better image with the names of the lines. Those lines are important. You can see the iliopectineal line connecting the ilium and the pubic bone, ilioischial line connecting the iliac bone and the ischial bone or ischium. So iliopectineal line and ilioischial line are important because if you see that those lines are disrupted, it can hint you that there may be a fracture of the acetabulum. So those lines are important. Now there is anterior edge and posterior edge of the acetabulum, and there is anterior column and posterior column of acetabulum. I'm not sure that Wikipedia showed this, so maybe, and there is the area of the teardrop right over here. You see the teardrop of the acetabulum. But I want to show you there is a posterior part and anterior part for the acetabulum and anterior column, posterior column. For each there is a fracture. You need to know that for fractures, but let's see if there is some, not too much. I don't know, I think that it shows you some, of course you can see here that the lines are disrupted totally. There is not much to it. You can see here the lines. Here the lines are quite disrupted. This line is quite disrupted. You can see that there is a fracture right over here. So you see that those lines are important. Now, in that acetabulum, there is anterior column and posterior column of the acetabulum. Just for the classification of fractures, I'm not going to get into this, but you can see that there are types of fractures, and there is both column. You can see that there is posterior column and anterior column for the acetabulum, and there is associated fracture with each of them. And the names of the fracture are considering the posterior column, anterior wall, posterior wall. So knowing the columns is important, knowing the anterior part and posterior part is important because the names of the fractures are going to be based on this classification, based on this separation of the anterior column and posterior column. Now, if we look on the classification system, again, the most widely used is the Jadet and Letourneau system. You can see that there are types. 5 of them is considered elementary fractures. like posterior wall, you can see the difference between posterior wall and posterior column. Now you can see that there are 5 elementary fractures, and there are 5, I'm not sure how we divide here, but there are 5 elementary fractures, and there are 5 that are associated, combined. Now, as I see here, I think that Orthopedia divide them based on the column they involve. Here you can see posterior column in dashed lines, anterior column without, but you can also divide them based on to two groups, each of them is 5, based on being elementary fracture or being associated, or if you want, combined fracture. I don't see that Wikipedia really does that, but if we look on Jeded Letournel classification, you will see that there is a classification based on elementary fractures, anterior column, anterior wall, posterior wall. Again, the difference between column and wall, and transverse. And there is combined, let's call it fractures, both columns, T-shape, transverse with posterior wall, posterior column with posterior wall, anterior column with posterior hemitransverse. So you can see those classification, each of them elementary and associated fracture, each group has 5 fracturing. Now again, I'm not going to get into each of them in imaging, but you can see the idea of elementary and associated fracture of each of them. The structure, which part of that acetabulum it involves. So this is the main idea I wanted to show you about the fractures. You can see here the treatment. Non-operative management may be indicated in the setting of minimally displaced fracture. It is more common in developing countries. Indications for non-operative management include patient fracture, delayed presentation, high operative risk, minimally displaced posterior wall fracture under 20 degrees, out of traction congruency between femoral head and radial groove, and displaced fracture with roof arcs, etc., etc. Operative may consist open reduction internal fixation, also known as ORIF, all total hip arthroplasty. Indication for ORIF: articular incongruence, displaced fracture above 2 mm, significant distorted acetabular roof arc, and acetabular roof arc. Let's show you this. This is right over here. You can see acetabular roof, maybe a little bit. Here it is, acetabular roof. This is acetabular roof arc disruption. Entrapped intra-articular fragment or loose bodies, irreducible fracture dislocation, and unstable fracture pattern. So you can see if you have a non-displaced, delayed presentation, not too much angulation fracture, you may think about non-operative management, but it's mainly in developing countries. And operative management, especially ORIF, is when you have a more displaced 2 mm and more angulated, or including the roof or irreducible fracture. Those are the criteria for ORIF intervention. Arthroplasty, when we're talking about arthroplasty, we're talking about things like, you can see here, arthroplasty. Let's show you the definition. To restore the function of a joint, this can involve resurfacing of bones or replacing the joint with an artificial joint prosthesis. So this is the definition. So when you're talking about arthroplasty, maybe more invasive procedure, more big procedure, elderly patient with significant osteopenia, communication, or pre-existing arthritis or post-traumatic arthritis in any age group when you are talking about replacing the joint. Complication, of course, remember that we need to talk about initial treatment with venous thromboembolism. So, of course, you need to think about complication of DVT, deep vein thrombosis. Osteoarthritis, as with any fracture, especially if not treated and not aligned well. Heterotrophic ossification, creation of a bone material outside of a bone inside the muscle. So you can see heterotrophic ossification that can be seen in radiographs like bone radiopaque area, classification in known bone area, or I don't know, CT, and anyway, heterotrophic ossification in area that should not ossify. Hip dislocation, of course, the hip can get out of place, what is called dislocation. This can be a complication as the area is destroyed. So this is about acetabular fracture. Remember the lines, very important lines, because if the lines are destroyed, you need to think about fracture. Roof, important for treatment. The area of anterior, posterior, anterior column, anterior wall, posterior column, posterior wall, iliopectineal line, ilioischial line, based on the bones it connects, and Shenton line, I less know about this. Okay, and the classification for 10 types of fracture based on the Judet and Le Tournelle system. 5 elementary, 5 associated, or if you want, combined. And we talked about complications and treatment based on the presentation of the fracture, the time of the fracture, the displacement of the fracture, the angulation of the fracture, the roof involvement of the fracture, arthritis, complications, and this is it. Thank you very much. If you have any corrections or I did any mistake, please tell me. This was about acetabular fracture. Thanks very much for Wikipedia. We saw some examples. Here you can see very nicely this side that is better with the iliopectineal line and ilioischial line, which are quite okay. But here you can see the lines are destroyed. The roof is disrupted. So this is an area with a fracture, and we can classify which side, which wall, which column was destroyed, was damaged by this is of course with fracture. The lines are destroyed, and here you can see that it tells you that anterior and posterior, probably anterior and posterior column fractures, anterior and posterior columns, so acetabular fracture and anterior posterior column fractures. You can see here the iliopectineal line is not normal, as we said. Again, the ilioischial line again is also, and the roof, acetabular roof, as we said, is again injured. Those are the lines. This is the roof. Important to identify. So knowing the lines is important. You can see, of course, in CT all the dash, and you can classify based on the classification system which type, which column exactly, and in what distribution was destroyed, and acetabular and iliac fractures. And here I don't see that they really defined what is the definition of this fracture. Not going to get into this. Let's see if they're not too much. They didn't talk too much about. Of course, you can see here the roof is damaged. Here you can see. Okay, I didn't want to get into too much. So if we're talking about anterior column and posterior, so you can see anterior column is right over here, posterior is right over here. So we can just, where it is? We can say that it's probably an anterior column fracture. Maybe there is involvement of the posterior column, right? If you look at, where it is? Where are you? Here it is. I think, okay. a little bit above the anterior superior iliac spine, going straight throughout it, involving the roof and getting to the posterior column. You can see here the line, getting right over here, I'm not sure, maybe it's just anterior column fracture, maybe only anterior column. They defined it, which column is, I'm not sure. Okay, so what can I tell you else? Maybe another. Okay, here of course you can see the fracture right over here. You can see the iliopectineal line that is disrupted. The ilioischial line is also disrupted. It's not. You can see the iliopectineal line which is disrupted. Here the fracture may be hard to see, but the iliopectineal line is disrupted, so you need to suspect a fracture. Here you can see the fracture, but it's quite subtle, so you can easily miss. Here you can also see, I think, a fracture, maybe. So it's very subtle, but the lines help you identify the fractures. So don't miss the lines. Look at the lines. The roof is also involved, probably. Maybe a CT could be a very good idea right over here. Here it's very easy to see that there is something wrong. The lines, of course, are destroyed totally. And okay. Thank you very much. If there are any mistakes or corrections about the acetabular fracture subject that we just talked about, please tell me. Thanks for Radiopedia. Thanks for every photo that I showed you. Not any credit for me, of course. Thank you very much, and this is it.